Lesson 1. Understanding the NICU. Why some babies need specialized care. What is the NICU? NICU stands for Neonatal Intensive Care Unit. It's a specialized area in the hospital where newborn babies stay that require further medical care. Common conditions for placement may include babies born prematurely, before they're fully developed, or babies born with health problems that require close monitoring and treatment. The NICU is designed to provide specialized care that cannot be given in a regular nursery. The doctors, nurses, and other healthcare professionals working in the NICU are specially trained to care for newborns with complex medical needs. They use advanced equipment and technology to help the babies breathe, monitor their vital signs, and treat any medical conditions. Although seeing your baby in the NICU can be difficult, it's important to remember that this is the best place for them to receive the specialized care they need. With the help of the healthcare team, many babies in the NICU are able to grow, develop, and go home with their families. In this lesson, you will discover the different reasons why a baby may need to be admitted to the NICU. Reasons for NICU admission. When you think of a baby in the NICU, you might picture a small, premature infant. This is a common scenario as NICUs often admit patients as early as 22 weeks gestation at select hospitals and care for babies born after their due date. There are various reasons why a baby may require admission to the NICU, including premature birth, low birth weight, breathing difficulties, infections, and other medical complications. Here I will list some of the most common NICU admission reasons. Breathing difficulties. One of the most common reasons for admission to the NICU is breathing difficulties. This is a common issue in newborns as their lungs are one of the last organs to fully develop. Some babies may need additional time to clear fluid from their lungs, while others may require more intensive support due to severe respiratory distress. Did you know that your baby's lungs are filled with fluid in the womb? Do you know how this fluid is cleared from your baby's lungs? In the womb, babies do not breathe air like you and me. Instead, they receive their oxygen from their mother's blood. While in the womb, your baby's lungs are filled with amniotic fluid. When a mother goes into labor, the contractions not only help position the baby for delivery, but also squeeze the baby, causing fluid to be expelled from their lungs. If delivery is too fast and the baby is not squeezed enough, they may have fluid left in their lungs, especially if they're delivered by C-section. To remove this fluid, we encourage the baby to cry after birth. Despite a successful delivery, some babies may still have fluid in their lungs, requiring NICU assistance. If a baby is breathing faster than normal, struggling to breathe, or making a grunting noise, they may need breathing assistance and NICU admission. Another breathing related reason for NICU admission is when there is stress during delivery, which can result in something medical professionals call meconium aspiration. Meconium is a sticky, tar-like stool that forms when your baby is in the womb. This tar-like stool is the first poop produced by the baby. If stress during delivery causes your baby to poop while they're still in the womb, your baby may inhale this poop while they are being delivered and can cause breathing difficulty and may require respiratory support. Here I will list reasons a baby can become stressed during labor and delivery. Prolonged or slow progressing labor. When labor lasts longer than expected or progresses slowly, it can cause increased stress on your baby's body and potentially lead to distress. Maternal infection with fever. If the mother develops an infection during labor and experiences a high fever, it can affect the baby's well-being and increase the risk of stress. Complications during delivery. Issues such as placenta abruption, the separation of the placenta from the uterus, cord compression, restriction of blood flow through the umbilical cord, and maternal high blood pressure can result in decreased oxygen supply to the baby and can contribute to their stress during delivery. Fetal distress. Any signs or symptoms indicating that the baby is not tolerating labor well can lead to increased stress. These signs may include abnormal heart rate patterns, meconium stained amniotic fluid, or other indications of compromised well being. Multiple pregnancies. When there are multiple babies in a womb, such as twins or triplets, the chances of complications during labor and delivery arise. This can heighten the risk of stress for babies involved. Maternal drug use. Substance abuse by the mother during pregnancy, including the use of drugs or alcohol, can negatively impact the baby's well being during labor and can contribute to increased stress levels. Blood sugar issues. In the event that your baby is experiencing low blood sugar levels, they may need to be admitted to the NICU for intensive monitoring and care. This condition may be caused by several factors, such as mothers having pre existing diabetes, developing gestational diabetes during pregnancy, or the baby facing difficulty maintaining their blood sugar levels during the transition period after birth. Maintaining normal blood sugar levels is crucial for your baby's overall health. If your baby is having difficulty maintaining their blood sugar levels, the NICU can provide the necessary care to prevent any adverse effects of low blood sugar. Unstable vital signs. Monitoring vital signs is crucial for babies. Vital signs include temperature, heart rate, blood pressure, breathing rate, and oxygen levels. If a baby's vital signs are unstable, they may need to be observed in the NICU. Temperature. If your baby has trouble regulating their body temperature, it may be necessary for them to visit the NICU for evaluation. The doctor will check the baby's blood sugar levels and perform other laboratory tests to rule out infection. In some cases, the baby may need to be placed under a special warmer or an incubator to maintain a consistent body temperature. The NICU staff will closely monitor your baby's temperature to make any necessary adjustments to ensure they remain warm and comfortable. Heart rate. If your baby's heart rate is either too slow or too fast, it may be necessary to visit the NICU for further evaluation and care. When a baby's heart rate falls outside the normal range, there can be various reasons behind it. To better understand the situation, healthcare professionals may need to conduct blood work, use a Holter monitor to check for any abnormal heart rhythms, or even consider medications. In some cases, observation alone may be sufficient to see if the baby's heart rate corrects itself. Low blood pressure. Low blood pressure in newborns can be a cause for concern and may require close monitoring and intervention in the NICU. Complications during delivery, such as blood loss, can contribute to low blood pressure in babies. When a baby's blood pressure is low, healthcare professionals will carefully monitor their condition in the NICU to ensure it returns to normal range. To better understand the underlying cause, blood work may be performed, providing valuable information to guide appropriate interventions. Depending on the results, medications or blood products may be administered to help correct the low blood pressure. In many cases, with proper care and monitoring, the baby's blood pressure can improve naturally over time. High blood pressure. On the other hand, high blood pressure in newborns is less common but still requires thorough evaluation and management. Medical professionals will conduct a comprehensive exam to identify any underlying causes. High blood pressure in newborns can be associated with conditions such as congenital heart defects, kidney issues, or certain genetic conditions. Determining the specific cause is essential for designing an appropriate treatment plan. The medical team, in collaboration with the parents, will develop a tailored approach which may involve medication or other interventions to address high blood pressure. Respirations and oxygen saturation. When it comes to your baby's breathing, both being too fast or too slow can be a reason for them to receive monitoring in the NICU. If a baby's breathing is too slow or too rapid, it may be a sign of respiratory distress, which requires close observation and specialized NICU care. Both slow and fast breathing rates can affect oxygen saturation levels, which measures the amount of oxygen in your baby's blood. It's important to maintain normal breathing patterns within the appropriate range to ensure that the baby is receiving the oxygen they need. That is why closely monitoring your baby's breathing and oxygen saturation levels is crucial. This allows healthcare professionals to promptly identify any abnormalities and provide the necessary interventions to support the baby's breathing health. Jaundice. When a baby is born, they enter a brand new world that is vastly different than the warm, cozy environment they were in within their mother's womb. One of the effects of this transition is jaundice. Jaundice is a condition where the baby's skin or whites of their eyes turn yellow due to high levels of bilirubin in their blood. Bilirubin is a naturally occurring substance in our bodies that is produced when red blood cells are broken down. Our liver processes the bilirubin and helps us excrete it from our bodies. When a baby is in the womb, the placenta takes care of excreting bilirubin for the baby. However, once your baby is born, their liver needs to start processing the bilirubin for them. Sometimes it can take a little while for the liver to get into the swing of things, and this can result in a buildup of bilirubin in the baby's blood. Around 24 hours of life, your baby's jaundice levels will be checked to make sure that they are not too high. If your baby has jaundice, they may require phototherapy treatment. The doctor may place them under a phototherapy light or on a phototherapy blanket for this purpose, either in your postpartum room or in the NICU, depending on your hospital's protocols. The phototherapy light helps break down the bilirubin in your baby's blood, reducing it to acceptable levels. Your baby's doctor will continue to monitor the levels and draw lab work to make sure their bilirubin is decreasing. During this time, it's important that your baby stays well hydrated. This can be achieved through breastfeeding, formula feeding, or IV fluids if necessary. Bilirubin is excreted from the body through urine and stool, and it is a good sign when your baby poops, as it means the jaundice level is decreasing. If you are pregnant and have blood type O, it's important to be aware if your baby has blood type A or B, as this can lead to ABO incompatibility. If this occurs, the mother's antibodies may attack the baby's red blood cells, leading to buildup of bilirubin in the baby's blood. Because of the increased risk of jaundice, your baby's doctor will likely draw lab work sooner after birth to ensure the jaundice levels are within normal range. If the levels are high, your baby may need to be placed under phototherapy lights or a phototherapy blanket. It's important to note that ABO incompatibility does not always result in jaundice. However, it's still important for your baby's doctor to closely monitor their jaundice levels and take appropriate action if necessary. Feeding difficulties. Feeding your baby is an essential part of caregiving responsibilities. During the first few days after birth, both you and your baby are learning a new skill, which can be challenging. Even if it isn't your first baby, each breastfeeding and bottle feeding experience is unique. If your baby loses too much weight in the first few days of life, it can be a concern for doctors. Usually, a baby will lose about 10% of their body weight within the first few days of life, but if they lose more than that, it can indicate a problem. Excessive weight loss may be due to a variety of factors, including inadequate feeding, poor latch, ineffective sucking, or oral issues such as tongue ties. Risk of infection. If a mother develops a fever during labor and delivery, especially if their water has been broken for an extended period of time, she may develop what we call chorio, which is a type of infection. The NICU team may be called to assess the baby's condition immediately after birth and may use a risk calculator to determine if special care or monitoring is needed. A neonatal nurse practitioner or neonatologist may want lab work drawn and prescribe antibiotics to prevent any infection in the baby. If antibiotics are required, your baby will be monitored in the NICU and an IV, like the one you had during delivery, will be placed in one of your baby's veins. Depending on your hospital policy, your baby may be able to return to your postpartum room between antibiotic doses. Low birth weight. When your baby is born, the weight at birth is a crucial indicator of their health and well being. If your baby weighs less than 5 pounds 8 ounces, they are considered to have low birth weight. This can be due to a variety of reasons, such as preterm birth, intrauterine growth restriction, IUGR, or other medical conditions affecting you and your baby. Being a low birth weight baby can lead to several medical issues, including breathing difficulties, low temperature, low blood sugar, and feeding difficulties. To ensure your baby's safety, they may need to be admitted to the NICU for observation and medical intervention. One of the primary concerns for low birth weight babies is breathing difficulties. These babies may require supplemental oxygen or mechanical ventilation to help them breathe. In addition, low birth weight babies may be at higher risk for infection due to their immature immune systems and may require antibiotics or other medications to prevent or treat infections. It is crucial to monitor these infants carefully to ensure that there are no other medical issues associated with being low birth weight. Genetic conditions. If your baby is born with a genetic condition such as Down syndrome, Turner syndrome, trisomy, or other genetic conditions, they may be admitted to the NICU for further evaluation. Each genetic condition carries different risk, and it is important for the NICU team to assess the baby's health thoroughly. Some genetic conditions may require more extensive medical care than others. Often, these conditions are detected during pregnancy, allowing parents to be well prepared. However, if the condition is identified at birth, the NICU team will provide you with the necessary resources and support to help you and your baby navigate this journey. Traumatic birth. When a baby faces challenges during the birthing process, such as getting stuck in the birth canal, the use of forceps or vacuum, placenta abruption, cord prolapse, lack of oxygen during labor and delivery, or a severe decrease in heart rate, it can lead to a traumatic birth. A traumatic birth can have profound effects on a baby's health and may require specialized intervention and monitoring in the NICU. Prematurity. Last but certainly not least, prematurity is another reason why a baby may be admitted to the NICU. Babies born before 37 weeks of gestation are considered preterm and may have various medical issues, including the ones that we have discussed in this course. If your baby is born before 35 weeks of gestation, they are considered high risk and will be admitted directly to the NICU per hospital policy. The staff in the NICU are highly trained and provide specialized care and will closely monitor your baby's vital signs, breathing, and heart rate. They provide medical interventions like respiratory support and medication to ensure that your baby's best chance of survival. It's important to note that not all hospitals have the capability of caring for premature infants, and your baby may need to be transferred to another hospital that provides the specialized care. As we come to the end of our first lesson in NICU Baby Basics, I want to take a moment to reflect on what we have learned. We now have a deeper understanding of the NICU and its critical role in caring for newborns who require specialized medical attention. We have also explored the different reasons that may lead to a baby's admission to the NICU. But this is only the beginning of our journey together. In our upcoming lessons, we will delve deeper into the world of the NICU, learning more about the different types of care provided and the challenges that families face during their stay. I'm excited to continue this journey with you and provide you with the best possible education and support for you and your baby. If you have any questions or suggestions, please don't hesitate to reach out. Remember, you're not alone in this journey. Together, we can navigate the complexities of the NICU and ensure that you are fully prepared for what to expect. Thank you for joining me in this first lesson, and I look forward to continuing our journey together.